So I think it's important to acknowledge from the outset that the achievement program was one of the things that was prescribed. The framework was prescribed, and our funding body had said that it was something that we needed to implement in the settings of early years services, schools and workplaces. However, that didn't mean that we did it and delivered it in an off-the-shelf way. We spent a lot of time in the early stages looking at the local context, so learning about the local system, listening, talking to people and building relationships, working out where networks already existed that we may be able to work with, and perhaps areas where we could start new networks or new groups. I think the other thing that we did with the achievement program was we really tried to see things from other people's perspectives. So from the perspective of early years services, we thought about how it might be valuable to them in other ways, and for early years it was through the National Quality Standard. Through schools it was through the Department of Education and Training focus on the principles of health and wellbeing, and for workplaces it was around occupational health and safety. So not going in with our own agenda and our own ideas about why it might be valuable was really important. Meeting people where they're at was another thing that was really important for us. While we went in with the whole framework in mind and knew that that was evidence-based best practice, we really met people where they were at, and if they just wanted to do components, that's where we started, and then we worked up to something bigger. One of the things I think we'd all agree on is our understanding of our role that we played in the system really changed and matured over time with the achievement program. We have really come to see ourselves as catalysts or agents of change, not the doers. Our role is to inject energy into the system, to amplify the energy where it already exists, to strengthen connections between players in the one system but between systems as well, and to highlight opportunities. And the achievement program was just a framework to do that, nothing more, nothing less. The bigger picture was and is that we are developing a system which values a culture of health and wellbeing, and we're agents of change.